A 32-year-old male opera singer has experienced progressively worsening hoarseness over the past 4 months. He also reports occasional throat discomfort, voice fatigue, and difficulty hitting high notes. Diagnose this patient using the virtual fiber optic scope. Diagnosis is vocal fold nodules, benign growths that typically occur bilaterally at the junction of the anterior 1/3 and posterior 2/3 of the true vocal folds. VFNs can be caused by vocal trauma without a period of rest. Symptoms include hoarseness, a rough voice, and neck and throat pain. Singers experience decreased pitch range and voice fatigue.